Hello, my name is Shelly Mowrey, and I'm the Prevention and Education Coordinator for the Arizona HIDA here in Arizona. I want to thank you for tuning in to this presentation today, The Rise of Fentanyl in Arizona. One reason we're here today is just simple and clear. We want to discuss and understand the dangerous rise of fentanyl right here in our own neighborhoods. But also, not only just understand it, but we want to know what we can do to take action in our community so that we can reduce the number of overdoses and deaths from fentanyl. So let's get started. The main thing is that fentanyl is here. It is everywhere. It is in all of our communities. Police and law enforcement are seizing thousands of pills, and it's really impacting every single area in our state, whether you live in a suburban area, an urban area, whether you live in rural area. Fentanyl is here, and please know that it is everywhere. Now I'd like to share with you a story of a mother that lost her son recently.
Isaiah was 15. He was in the middle of his sophomore year in high school. He just had this light about him. I get notification from a family member that there's a picture of Isaiah passed out. They're saying that he took a pill. You know, he went to go lay down and he just wouldn't get back up. We're pretty sure that your son ingested fentanyl, and they're telling me he's not gonna make it. And I just told him, like, you know, I love you no matter what. And you didn't deserve this.
Learn more at talknowaz.com.
Isaiah was just 15 years old, and very unfortunate circumstances where he thought he was taking something, and it was a pill that was laced with fentanyl. So let's get to it today, and let's go over the issue and then what we can do. Today we're going to take a look at what fentanyl is to provide you with a better understanding about what the substance is. We're going to take a look at how big the problem is here in Arizona, and then finally, again, what we can do as members of our community, as parents, as grandparents, as foster parents, whoever you are and whatever it is that you do. If you are involved in a child's life, we're talking directly to you today. It's important that we work together so that we can actually help save lives. So taking a look at what fentanyl is, it's kind of confusing, and fentanyl is an opioid, and opioids are a class of drugs used to reduce pain. There are several different types of opioids in that class. First, there are prescription opioids, opioids like these that are used to treat moderate to severe pain. These are examples of the different types of opioids. Fentanyl is a synthetic or a man-made opioid that is 50 times more powerful than heroin and 100 times more powerful than morphine. Prescription fentanyl is used for treating severe pain, typically advanced pain. Illegal fentanyl is manufactured in drug labs and often pressed into counterfeit pills that look very similar to prescription and legal prescription opioids. Fentanyl can be found in counterfeit pills, or it can also be mixed with other drugs like meth, amphetamine, cocaine, and heroin, and sometimes it's added with or without the user's knowledge. It only takes a little to lose a lot. A small number of grains of fentanyl are enough to take a person's life. The other opioid in this class is heroin, and heroin is an illegal opioid. It comes in powder and also a form called black tar. The bottom line is that all opioids are addictive, and users can develop a dependence and they can overdose. Fentanyl carries a much higher risk for overdose and death. So what does fentanyl look like? Prescription fentanyl is prescribed in the form of transdermal patches, lozenges, tablets, or a nasal spray. However, most recent cases of fentanyl-related harm, overdose, and death in Arizona are linked to these. These are illegal fentanyl pills that are laced with fentanyl. So they're designed to look like real prescription drugs, but they're laced with fentanyl, again, with or without the user's knowledge. Most of the fentanyl consumed by our kids and young adults in Arizona is in the form of these counterfeit pills, and that's where we're going to turn our focus now. So this is really the most common form of illegal fentanyl. It's in pill form here in Arizona. These are examples of some of the counterfeit pills that are laced with fentanyl. They're designed to mimic those real prescription medications like Xanax or oxycodone, but they have none of the properties of those legal drugs. They're counterfeit that contain fentanyl. One thing to keep in mind is that when these counterfeits are being made, the person has no idea how much fentanyl is going into one of these tablets. For instance, think of something like making chocolate chip cookies. When you make a batch of chocolate chip cookies, there may be one chocolate chip cookie with 4 chocolate chips, and there may be one chocolate chip cookie with 8 chocolate chips. The same thing is happening here with these fentanyl counterfeit pills. One pill may have little to no fentanyl, but one may have a lethal dose that could take a young person's life. That's how dangerous they are. So how are these pills being used? They're being used in a number of different ways. They can be swallowed, they can be crushed into a powder and inhaled through the nose, they can be smoked. The pills are crushed and then commonly placed on like a tin foil and smoked. A telltale sign of someone smoking a counterfeit pill is if you see tin foil in your home, and you might also find, again, the tin foil might have black lines on it. You might find them around the house. It could be in their pants pocket. It could be in their car, and those types of things. The pills can also be crushed, heated, and injected into the arm. So how big is the problem here in Arizona? When we take a look at the number of overdoses in Arizona, you can see that 42% of all overdoses in the state of Arizona involve fentanyl. In fact, fentanyl was the #1 substance found in opioid overdoses. So the big question is, why is this occurring? Why is this happening here in our state and in our community? Well, the reason why is if you take a look at this graph, you can see that in 2018, fentanyl really wasn't even on our radar. We weren't seizing a lot of pills or fentanyl. But as the year went to 2019, and then as you see in 2020, the number skyrocketed. In fact, there's been over a 1,600% increase in the number of counterfeit pills seized here in Arizona. So we know when there's increased access to a substance, there's increased availability, increased use, and increase in overdoses. So it's a perfect storm. The other thing that we're seeing here is that with our youth especially, just like with Isaiah in the video that I shared earlier, youth may think that they're getting a Percocet or oxycodone tablet. They may think they're getting a legitimate prescription medication when in fact it's not. It's that person has obtained it outside of a pharmacy, and those pills are dangerous, and those are counterfeit and contain fentanyl. So while the kids may think that they look like real prescribed medications, they're not, and they're especially dangerous. So it's really important here to talk with your child about never ever taking a pill that hasn't been prescribed to them, doesn't come right out of the prescription bottle, to never take a pill that comes from a text message, on social media, or anything like that, because more than likely those do contain fentanyl and can be deadly. So the other thing too that we're seeing right now is that with the increases in the number of counterfeit pills in Arizona in our communities, it's easy for kids to get their hands on them. You know, kids are often buying these pills on social media sites like Instagram, Snapchat, TikTok, and they also buy and sell these pills through text messages. In many cases involving youth, there is more than one person present at an overdose, and youth appear to be using these substances in small groups where they share them. Now, I do want to point out here that we have another great presentation just on Snapchat on talknowaz.com. So I'd really like to encourage you that once you see this presentation, that you also go more in depth and watch that Snapchat presentation, because it's very informational in terms of how kids are using this platform to obtain substances. In addition, there are many reasons why kids are using these substances. Some of us are like, why are they using these if they know that they're dangerous? Well, there are a number of different reasons, and for some youth it may be just as simple as it's the next substance to try. If a teen is involved with other teens who drink or vape and they've also heard about pills, they may be curious and they may just try them out of curiosity, not understanding the risks of fentanyl and that the pills are counterfeit. We also have a lot of youth here in Arizona that are using substances to deal with stress. That can be emotional stress, it can be pain from an untreated mental health problem, and oftentimes we call this self-medicating. It also can be stress from the pandemic or family situations that kids and families have been through in the recent year. That stress can come from school, family, friends. And then some teens do start taking prescription pain relievers. And then they develop a dependence and a tolerance for those. And once they can no longer get those through a legitimate source, like a doctor, if a doctor stops prescribing, then they'll turn to the streets and get illegal sources. And that's where it becomes really dangerous, because we know the pills on the street are counterfeit and contain deadly doses of fentanyl. So be especially vigilant. I want to repeat this as a parent. Be especially vigilant if your child is prescribed an opioid, for instance, in the result of a sports injury or dental surgery or something like that. Also, I want to talk a little bit about what puts your child at a higher risk. Now, this is not saying that if your children and your family has all of these things that they're doomed to have a substance use disorder. This is really meant only to say that under these circumstances, you need to be more vigilant, and one of those is a family history of substance use. So while there is a stronger biological risk if a child's parents have a substance use disorder, your child is at an elevated risk if an aunt, uncle, grandparent, or cousin has had a substance use disorder or is in recovery. If there is a history of dependence or addiction in your family, you should let your child know that they are at a higher risk for developing a substance use disorder. And really talk about it in the same way that you would if in the cases of a heart disease in your family, or if your family is more likely to have diabetes. Also, if our children have an undiagnosed or diagnosed mental health problem, things like with depression, anxiety, attention deficit disorder, that also places a child at a higher risk for substance use. And though not all young people with these disorders will again develop a substance use problem, the chances are higher when they have difficulty regulating thoughts and emotions. So it's really a good idea to talk with your healthcare provider about the connection between mental health and substance use, and managing and treating those underlying mental health conditions, or understanding how the emotional and behavioral health problems can trigger or escalate a substance use problem. It's really important to help us reduce the risks of developing a substance use disorder. Also, I want to talk a little bit about trauma and a traumatic event. So we know that kids that experience trauma are also at an increased risk for substance use. That can be something as simple as experience or witnessing a car accident, experiencing a natural disaster, but also things like being a victim of physical or sexual abuse. Those things have been shown to increase a child's risk for substance use problems later in life, and it's really important for parents to recognize the impact that trauma can have on their child, and to get help for their child if they've been through a traumatic incident or suffering from toxic stress. And remember also, for a teenager and a pre-teenager, that a traumatic event could also be something like getting injured and not being able to play a sport that they've loved or that they've played since elementary school. Or it could be something like breaking up with a boyfriend or a girlfriend that they thought, may be the one. So those things can also be really important to watch for. The other thing too is impulse control difficulties. And these are the kids that I like to call the kids that would go to the top of a ski slope, they would point both skis straight downhill and take off. So those kids that are often engaging in risky behaviors and have impulse control difficulties are more closely related to substance use disorders too. If this is the case with your child, it really is helpful to have a conversation about the consequences of his or her actions, to reinforce times when your child demonstrates control or chooses safety over risk, and really to teach mindfulness skills with children. Professional counseling may also be important in this setting as well. So what can we do? So now we've talked about sort of what is fentanyl, we know what it is, we know how prevalent it is in our communities. So what are some things that we can do? What are some take actions that you can do right now in your family? So really all of us play a role. No matter who you are in the community, everyone can play a role. So through prevention, right? That's where I come from. I'm a primary preventionist. So I want to sort of stop substance use before it starts. So we want to encourage our kids to make healthy choices and not engage in substance use. Also by screening and intervention. So we want to be able to identify people that might be early in their use so that we can get them the help they need. Early detection is so much better. The one thing I will tell you is that if you've got that sixth sense in your gut telling you that something may be wrong, follow up on those impulses, because again, the earlier that we can get our kids help if we suspect something, the better outcomes we see. Also, we know that by preventing overdoses through carrying something called naloxone, and we're going to talk about that a little bit later, and then through effective treatment and continuing care, knowing that treatment is possible and there's always hope for recovery. So what can parents and caregivers do? Talk early and talk often. I know I'm raising a teenager, and sometimes it seems like we're just talking to a brick wall, but it really does get in there. And so we want to make sure that we're talking with our kids, because kids that learn a lot about the risks of substances from their parents are up to 50% less likely to use. So it's really important to do that. So we want to make sure that we're offering advice and guidance to our children. We want to make sure that we're setting limits that you as a parent can also live with. We also want to make sure we're showing concern rather than anger. You know, teens can be frustrating in a number of ways, but what you mostly feel for your teen is that love and concern for your child, and let them know that you feel that love and concern for them. Make sure you're asking open-ended questions. Ask your child, tell me about your night instead of where were you? Have them walk you through what their night was like. And again, it can be hard, but try to understand your teen's point of view, because let's say your teen wants to go to a concert and that they're just dying to go to this concert. And so, ask your child, so why is it so important for you to go to this concert? And again, they still may not be able to go, but at least you're approaching it from their point of view and understanding why it's so important for them to go. And then lastly is to establish a rescue plan. So the rescue plan that we have set up in our household is, and you can set it up however you would like. If you're more inclined to text your child, or if you talk via WhatsApp or some of those other programs, choose something that you and your child both like to use. And so our phrase in our house is, Mom, I forgot to feed the dog. So if I see that text come from my son, I know that that's an emergency text, and so I text him back and I say, that's the third time this week you forgot to feed the dog. Where are you? I'm coming to get you right now. So what he's talking about with his friend, to his friends, is like, oh my gosh, you forgot to feed the dog for the third time this week. Yeah, you're in a lot of trouble. Your mom's coming to get you. So think about creative ways like that you can help get your child out of situations, whether it's drugs or alcohol, or whether it's just in a situation they no longer feel comfortable with. This rescue plan can work for a lot of different things. Also, we have to monitor social media. So you want to take note of the social media sites that your child visits. This is really, really important. And so before they get a social media account, talk about some of the rules that you're going to have around the social media accounts. And we do have social media contracts and online internet safety contracts that you can download from talknowaz.com. Ask your child for their usernames and passwords and keep track of those. I know I've got a long list of passwords in my house. It's like username, password. It's hard to keep track of those, but again, it's really important because you'll need to be able to go in there if you suspect something. Set limits on how much time your child is spending. Talk with them about what people are seeing and posting. Recently, I started asking, when we have dinner together, I just ask them, I said, so what are people talking about today? So it's not ever in conversation. It's only what people are talking about via, like what he's seeing on Instagram or something like that. So as you have these conversations, so what are people talking about today? What are you thinking about that? And so it really helps engage in a conversation with your children. And again, I just want to promote the Snapchat talk on talknowaz.com also. The other thing that I'd really like to talk with you about too is to ask your child, let's just say that you've done everything you can, you've talked with your child about avoiding substances, but unfortunately they've been in a situation where maybe they've been taken to an emergency room with a broken bone or an injury, and they may receive a prescription for an opioid pain reliever. So your son or daughter may receive a prescription for a prescription pain reliever after dental surgery also. So a lot of our teens get their wisdom teeth cut out. So ask your healthcare provider or dentist whether there are alternatives to ease the pain that don't involve opioids. Some of those include things like what we call NSAIDs, things like Motrin and Aleve, ibuprofen, those types of things. And then acetaminophen is like a Tylenol. A local anesthetic would be something like a pain blocker that can be used in a shot or one shot or multiple shots. And then also some alternative approaches like acupuncture, physical therapy. Those things can be used to help reduce the need for opioids. So again, we want to try to keep our kids as opioid naive as long as possible, but understanding there may be times when they need an opioid, but do ask for an alternative if it's a possibility. Also, there are still a lot of kids accessing prescription medication right from the home. So you want to make sure you're storing your medications in a place that's safe. You also want to make sure you're getting rid of any unused, expired, or unwanted medications. And you can go to dumpthedrugsaz.org to find out information on where to find the nearest prescription drug drop box closest to your home. So this is a text message of a young man who was sharing a conversation with a friend of his about the pills that he was taking. And as you can see here, they're having a conversation where, he's talking about taking perks and fentanyl, and that he's scared, to go back to jail, and he's like telling the person not to tell anyone. And so while the person is saying, please, call your mom, you're not alone, you have a lot more to lose than you realize, he texts back, I can't breathe. And that was the last text message because the young man died. And so it's really important that when we're talking with our kids, that if they were to ever see a text message like this, to always call 911 immediately to get help for that person. And Arizona has what's called the Good Samaritan Law. And that means that if your child suspects that someone is in trouble or they're at the scene of an overdose and they call for help, they will not get in trouble for reporting that to the police. And so I just want to share a quick video from a local police, retired police chief.
I'm Deborah Black. I'm here to ask for your help to save lives during this opioid crisis. Individuals who have overdosed are being left to die because those around them are afraid to call for help. Arizona's Good Samaritan Law protects those who call 911 when they are present during an overdose. On behalf of law enforcement, please make that emergency call. You will not be arrested. You plus naloxone are a combination that will save lives in Arizona.
So it's really important to know the signs of an opioid overdose. And here are some of the signs of an overdose. So like heavy nodding, deep sleep, they're hard to wake up. So what happens with fentanyl is that it affects the heart and the lungs. As they slow down and weaken, the entire body can be affected. So erratic breathing leads to snoring, gurgling, or choking sounds. The lips, the fingernails, or the skin can turn purple or a grayish color. The skin can feel clammy or sweaty. If you encounter a person who is experiencing these effects, the first thing you want to do is call 911. It's important to note that naloxone can reverse an overdose, but it's always important to call 911 because it's important to seek help for that person in getting some additional help if they need it after the reversal of the overdose. Naloxone reverses the overdose by working to restore breathing and the heart rate. It is a critical tool that's used by first responders and law enforcement, but anyone can now get naloxone, and a prescription isn't necessary. All you have to do is ask your pharmacist for it. So it's important to always have naloxone available just in case. You can make it part of your regular first aid kit. It can be purchased at most pharmacies, or a lot of community coalitions are also providing naloxone for free of charge. So once you get it, remember where you put it and place it in a place where you will remember where it is. Don't be afraid to have naloxone in your home, especially if you have young kids or young adults in your home. You can find the nearest location for naloxone at naloxoneaz.com. I'd also like to share with you the story of a young man who got a second chance at life just because of naloxone.
If this can be assistance to even the one person, that's what it's about. It's not about me. It's not about John Crow. But I did do drugs. I did overdose. I did get a second chance by the help of Narcan, paramedics, police officers. I lost nursing school. I was homeless. I had nothing. Now I have a house. I have a job. I have beautiful connections. I love the Lord. That's where I'm at now.
And so in the same way that people start using opioids for a number of different reasons, there are many factors that drive continued use of opioids. Again, everyone is different, so every situation is different. So you've got genetics, you've got the person's physiology play a major role. Two people can try the same opioid, one can develop a dependence, and one can never touch them again. But with taking a look at opioids and other drugs, the body can develop a dependence and a tolerance for it. In that case, the person has to use more of the drug to achieve just a feeling of normal. And eventually they no longer feel good, and so they're having to adjust to higher levels in order to get that feeling of just feeling normal and not going into withdrawal, because that's a lot of times fear of withdrawal can keep a person from not using. And so they're afraid that the withdrawals have been described as basically the flu times 100. A user just feels sick and acheful and has restless and anxiety. And so there are a lot of things that go along with withdrawal. And again, when people are wanting to stop opioid use, they're really afraid of those withdrawal symptoms. And at a very basic level, withdrawal undoes everything that opioid intoxication does. And so when that pendulum swings back from opioid use to withdrawal, it can be very painful. Oftentimes we think, well, we oftentimes find ourselves saying to a person, well, if you'll just stop, everything will be okay. And physically, people can't stop with opioids because their body has developed this dependence and tolerance for it. So, and if the person using gets through physical withdrawal, they then may experience some emotional withdrawal from the substance. They're missing the feelings that opioids brought them. That can also result in a relapse. And what a relapse means is when a person starts using that substance again. And relapse is especially dangerous with opioids because, again, after someone stops using, sometimes they go back to using at the same level as they were using when they stopped, and that can lead to an overdose and death. So again, really important, you have a loved one, it's in opioid use disorder, has an opioid use disorder or in treatment, it's important to have naloxone in your home. Now, discovering or knowing that your child's actively using opioids often elicits many emotions. Some parents are angry, some are disappointed in their child, others are fearful because they're just fearful of the possibility of what may happen with their child, and others feel guilt and shame, but there is hope and treatment does work. So the number one thing we want to do is ensure safety. There are several steps that you can take to help a child. The first should be to have naloxone in your home. To determine the best course of action for you or your child, get an evaluation by a professional. That's a really crucial step. The person will ask many questions and various assessments will be used to determine what kind of care your child may need. Your insurance company can provide recommendations for evaluations as well as your child's doctor. Other helpful resources could be someone like a school counselor, an employee assistance program, or a support group. Also, sometimes teens and young adults are more willing to engage in treatment because they recognize what's happening in their lives and actually they're ready to live a healthier life. In other cases, it may not be that straightforward and you'll need to use your influence and possible leverage to make that happen. You may have heard the phrase that your child needs to hit rock bottom before they want help or get help, but that's really not true. Our loved ones are interested in getting help, but we may not always be listening for what they're saying to get them into the help and treatment that they need. And in many cases, if we wait till our child or loved one reaches rock bottom, it may be too late because with opioids and with fentanyl, it's especially dangerous. So the other thing too in suggesting treatment after that is to listen for change talk with a person. So change talk is anytime your child may voice a concern over the way things are going in their life and talking about a desire and change in some way. And so let me just give you some examples of what that change talk looks like. So, the change talk is, your child saying, I'm feeling really depressed, I don't have decent grades. So as a parent, coming back and saying that, I know you've been saying that you want to get better grades for some time. What do you think is getting in the way of that? And so that's change talk. Another one may be, I think I really upset my boyfriend, girlfriend last night when I was out of it. So again, as a parent listening to that, what are your thoughts about how your use is impacting your relationship with your boyfriend or girlfriend? Again, just thinking about it in a different way and listening to that change talk, listening for things that they're telling you and providing you with little clues to that. If you need help with opioid use disorder or any opioids, or you have any questions about opioids or naloxone, Arizona has an opioid assistance referral line, and that number is 1-888-688-4222. If you have a phone and you'd like to take a picture of this slide, we'll pause here. Again, the number is 1-888-688-4222. Our next slide in terms of seeking treatment options, it's really important because there's not a one-size-fits-all for everybody. It's really important to ask questions, support recovery, and then also to get self-care for yourself. Because as you go through this, helping a person struggling with a substance use disorder can be exhausting and overwhelming. And so there are parent support networks there, which we're going to talk a little bit more about. But there are also guides on continuing care that can assist in that as well. So here's some help for parents and caregivers. These tools are designed for parents and caregivers. There's Hope and Help texting program. This slide shows how it works. All you do is you just text JOIN to 55753. You answer some questions and they will text you back. So these are answered by licensed qualified counselors in terms of texting. There's also support for parents and caregivers in terms of parent coaching. So if you would like to be partnered up or with someone in a similar circumstance, this parent coaching option is just a terrific option, and that is run by the Partnership to End Addiction. And I'll give you the web address for that coming up. Additional resources would include naloxoneaz.com, where you can find the closest naloxone distribution point to your home. And then lastly, here again, if you have that phone out and you'd like to take a picture or a screenshot of this slide, these are resources that are available. There's the talknowaz.com. So there you'll find facts on fentanyl, you'll find talk sheets, you'll find those internet safety contracts. Naloxoneaz.com, that's where you find, again, the place closest to you to get naloxone. And then drugfree.org offers help for that texting hotline or the texting option, the parent coaching option. And then also there is a helpline that you can call also that's answered in English and Spanish. So with that, I want to thank you for taking the time today. With your help and with our community's help, we know that we can help prevent the number of young people, and especially our children, dying from these counterfeit pills laced with fentanyl. So thank you for joining.